Bonjour à toutes et à tous. Thank you for joining us. Merci d'être parmi nous aujourd'hui. We are here today to provide an update on the City of Ottawa's response to the COVID-19 pandemic. Nous sommes ici aujourd'hui pour vous fournir une mise à jour sur les mesures prises par la Ville d'Ottawa pour faire face à la pandémie de COVID-19. My name is Kina Leclerc and I will be your moderator. Je m'appelle Kina Leclerc et je serai l'animatrice de cette séance. Today we will be hearing remarks from Mayor le Maire Jim Watson, followed by Councillor Keith Egli, Chair, Ottawa Public Health Board, le conseiller Keith Egli, président du Conseil de santé d'Ottawa, Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, and Anthony DiMonte, General Manager of Emergency and Protective Services, directeur général des services de protection et d'urgence. Available for questions from the media following the statements, we also will have, disponible pour répondre aux questions des médias, nous accueillerons aussi Chief Peter Slowly, Ottawa Police Service, chef du service de police d'Ottawa. After we hear from the panelists, we will take questions from the media. We will begin now with remarks by Mayor Jim Watson.
Thank you very much, Kina. Bonjour, mesdames et messieurs. Bienvenue, welcome. Thank you for joining us. I'd like to begin by obviously commenting on the last couple of days. It's been a flurry of activity over the course of the last 4 or 5 days. And I want to thank the province on a couple of fronts for pulling back on the proposal of random checks by our police service. Obviously, there's not a lot of support for that. And I appreciate the province listening to our chief of police, myself, other mayors and other chiefs across the province. Also pleased the province has reconsidered the closure of play structures around Ottawa and Ontario. This is welcome news, obviously, for many residents, particularly families with kids, and recognize that this was something that I know a number of my other colleagues from around the province engaged with the province, as did I. We appreciate them pulling back on that particular issue. I'm also pleased to report that as of today, our park ambassadors are back out in select parks around the city. Park ambassadors will walk around these parks in pairs and will be giving helpful guidance on keeping your time in the park safer for everyone. You'll be able to spot them as they'll be wearing either their green shirts or red jackets and identify themselves as City of Ottawa staff. These park ambassadors are not enforcement officers and they do not hand out tickets. They're existing city employees that are being seconded to this particular role. They are live on the spot resources that help residents by offering valuable information, answering your questions, and helping to explain any confusion that might be around when it comes to the city's parks or the province's stay-at-home order. Je souhaite remercier les ambassadeurs pour leurs efforts d'éduquer les résidents et de promouvoir l'activité saine et de sécurité dans nos parcs ici à Ottawa. As many of you are aware, as part of the province's enhanced restrictions under the stay-at-home order, they've also required that checkpoints be set up between the Ontario and Quebec border. As we saw over the first day in particular, with the checkpoints being up and running, travelers were experiencing significant delays at all Ottawa area interprovincial crossings, the 5 bridges and the 2 ferry crossings. Yesterday, I wrote to Minister Jones and requested that she revisit the request for our police services. It was costing a significant amount of money. It was not particularly effective. And the letter outlined the detrimental impact that this is having on thousands of healthcare workers. We know there's between 6,000 and 6,500 healthcare workers that work in long-term care, hospitals, retirement homes, clinics here in the Ottawa side. And as you saw, those checkpoints were causing hours of delay of people getting into their essential work. And quite frankly, many of these people were late for working in intensive care units or helping the elderly in retirement homes. So yesterday, I was very pleased to see the notice from Chief Slowly, and I thank him that the Ottawa Police will no longer maintain a 24/7 presence at the interprovincial crossings, the 5 interprovincial bridges, as well as the 2 ferries. The OPS will instead deploy officers on a rotating schedule of checkpoints moving throughout the city of Ottawa, interprovincial crossings on a daily basis until the expiry of the provincial order. Alors, le SPO va stationner les policiers à des ponts sur un horaire de cycle à travers les points d'entrée jusqu'à la fin du décret provincial. The OPS will continue to work with OPH, the City of Ottawa, the City of Gatineau, and the Ontario Provincial Police and other partners to conduct daily assessments on the border operations. I understand that these sudden changes from the province can in fact be confusing, but I want to take this opportunity to stress that you please follow the public health guidelines, and in doing so, you'll be helping to protect yourself and of course your loved ones. Stay home for essential reasons, keep your close contacts to those only in your household. When you leave the house, bring a mask with you, wear it. If you're indoors or in situations where you'll be interacting with people outdoors, stay home if you're feeling sick, and when you're eligible, please sign up for a vaccine. I've added my name to a wait list at a local pharmacy to receive the AstraZeneca vaccine, and I hope to be able to schedule an appointment in the next coming days or a week or so. Now, on the subject of vaccinations, I'm pleased to announce that thanks to the great efforts of all of our healthcare professionals, our paramedics, our staff, we have administered over 284,000 vaccines to date. As of Monday, we surpassed delivering doses to 25% of the population over the age of 16. So that's pretty remarkable. 25% of our residents over 16 who wanted a vaccine have been vaccinated, and kudos to our staff for doing such a great job. It's been a difficult year. I don't have to repeat that. Everyone knows that. It's been a challenge economically, socially, mentally, physically. And there's no question we are making some progress, but we still have a long way to go. We understand that everyone is getting tired and that COVID fatigue is setting in. C'est clair que plusieurs sont fatigués et que le virus nous pousse aux limites. Every person vaccinated, of course, brings us one step closer to bringing the pandemic to an end. So I want to thank everyone for their efforts to date. In the meantime, I urge everyone to please continue to stay at home and stay the course and follow public health guidelines. Great information on ottawapublichealth.ca or ottawa.ca. It's in everyone's best interest, obviously, to stay home as much as possible and limit your personal contacts to those that you live with. Merci beaucoup, and I'll hand it over to Councillor Keith Eglai, the Chair of Ottawa Public Health, who's putting in lots of hours.
Thank you, Mr. Mayor, and good afternoon, everyone. Bonjour, Kwe. Thank you for joining us this afternoon. It's only Wednesday, but there's been lots of new developments regarding the vaccine and new public health measures this week. It started with the provincial announcement on Friday, then the welcome news that those 40 plus would be eligible to receive AstraZeneca in pharmacies on Sunday. And the next day, we had a very lengthy but very worthwhile Board of Health meeting where we heard concerns from those working in the childcare sector and other essential workplaces. There's lots of information circulating, but I want to drive home a few main points today. The first is that Ottawa's hospitals are still struggling, and to help support our healthcare sector, we need to do all we can to adhere to basic public health measures, such as masking, staying 6 feet apart when interacting with those outside of your household, and staying home when sick. In this spirit, yesterday, on behalf of Dr. Etches and Ottawa's Board of Health, I submitted a letter to the Premier requesting additional COVID-19 restrictions and enforcement. The request was made to limit the places where people come into close contact with people outside of their household. We're trying to work together to prevent outbreaks before they happen, instead of acting after the fact. Dr. Etches will speak to this more shortly, but we hope to receive a response from the province in the following days. As the Mayor has mentioned this week, Section 22 order was issued that makes masks mandatory while playing on or within 5 meters of the play equipment at city parks. We know that many parents and children in Ottawa are already wearing masks whenever they are in public, but this order helps to ensure that children can still use play structures and areas while being as safe as possible. The past few weeks have been extremely difficult for families, and we know many are struggling with distance learning at home while trying to balance other professional and personal responsibilities. This is a very difficult time. I'd like to thank all the parents, guardians, educators, and childcare workers in Ottawa who have continued to persevere. I want to thank all the kids in Ottawa as well that have done their best to put up with all these changes and restrictions that I'm sure are strange and foreign to them in their childhood. In supporting and reinforcing public health guidance, you are making a difference in helping to keep others in the community safe. Thank you for all that you do. And lastly, get your vaccine. AstraZeneca is now available to residents 40 years of age and older at local pharmacies. Please encourage your friends, families, colleagues, neighbors, everyone you know to please get a vaccine when they become eligible. So you've heard me say many times in the past few weeks, I got my vaccine last week and have no regrets. A list of participating Ottawa pharmacies is available on the provincial website. And as the mayor indicated, it's quite easy to go online and pre-register for an appointment. If you're under 40 and would like to know if you're eligible for a vaccine based on other health conditions, you can visit Ottawa Public Health's website to see if you're eligible and pre-register for a vaccine if you qualify. Thank you to all residents for your continued support of OPH. Working together, we can get through this. Thank you.
Thank you very much, Councillor Eglai. We will now be hearing from Dr. Vera Etches.
Well, good afternoon, Quay. Well, bonjour. And as Chair Eglai mentioned, a letter was sent yesterday to the Premier requesting an urgent review of all businesses and services that continue to have workers at work in the workplace, to amend the language in the Ontario Regulation 82/20 regarding school closure to provide greater clarity that as many students as possible should be participating in virtual learning, and to improve the enforcement provisions under the Reopening Ontario Act and the Emergency Management and Civil Protection Act. The reason for this request is that workplaces continue to be places where people come in contact, close contact with each other, and where COVID-19 is transmitted. Le milieu de travail continue d'être des endroits où les gens entrent en contact étroit avec les autres et où COVID-19 est transmis. And with the current pressures on our healthcare system, we do need to flatten the curve. We need to turn the curve again by decreasing every opportunity for transmission. And of course, workers that are affected need to have access to financial supports. In Ottawa, the number of businesses that have more than 5 people testing positive is limited. They include a lab, a gym, 2 transportation operations, 2 construction companies, and 5 restaurants offering takeout. And along with restaurants, offices are also close to the top of the list for workplaces that have experienced outbreaks. And sports and recreation activities are also a top contributor. So at this point, under provincial regulation, people who can work from home must work from home. And sports and recreation activities should be with members of one's household only. And where people cannot be distanced from others, wearing masks is key to stopping transmission of the variants of concern, which are now making up close to 100% of what is found in our wastewater when we look at all of the COVID. En vertu de la réglementation provinciale, les personnes qui peuvent travailler à la maison doivent travailler à la maison, et les activités sportives et récréatives doivent se dérouler avec des membres de leur ménage. Lorsque les gens ne peuvent pas être éloignés des autres, le port de masque est essentiel pour arrêter la transmission des variants préoccupants. C'est presque 100% de la COVID dans notre eau usée qui est un variant préoccupant. And so additionally, I have provided instructions to businesses previously to inform Ottawa Public Health when 2 or more people test positive within their workplace within 14 days of each other. Ottawa Public Health's case management team continues to be able to work with these businesses and residents to manage these situations so that further transmission is prevented. Our situation in Ottawa is unique. We're not seeing the same trends of workplace transmission and the scale of outbreaks, the size of outbreaks that other places like Toronto and Peel are experiencing. Notre situation à Ottawa est unique. Nous ne voyons pas la même tendance de transmission en milieu de travail et l'ampleur des éclosions que d'autres endroits comme Toronto et la région de Peel. So we continue to monitor the situation. We're looking at everything locally as well as across the province. And we're evaluating all possible options to reduce the spread of COVID-19 in our communities based on the data available. So I look forward to further discussions with the province about how to best implement any new measures here. I also want to take a moment to remind people who have received a vaccine, and whether it's one dose or both, I want to speak to people who will be receiving a vaccine soon, to let you know that we all do, after we're vaccinated, need to continue to keep up with behaviors like maintaining distance from others, wearing a mask, and keeping your hands clean when with people outside of your households until more people are fully vaccinated. People have tested positive for COVID-19 in the days following immunization, as the vaccine takes time to build immunity and it's not 100% effective. Ceux qui ont reçu un vaccin doivent suivre les mesures de santé publique. Il y a des gens qui ont obtenu un résultat positif au test de dépistage de la COVID-19 dans les jours suivant l'immunisation, car le vaccin prend du temps à développer une immunité et n'est pas efficace à 100%. With high levels of COVID in our community, we expect to continue to see a small number of vaccinated people test positive. After you receive your vaccine, you will also have information on post-vaccine behaviors given to you. Please read this and follow the guidance. Après avoir reçu votre vaccin, vous recevrez de l'information sur les comportements post-vaccination. Veuillez lire ce document et suivre les directives. Taking these precautions will assist the whole community to drop the level of COVID-19 as quickly as possible. Lastly, I also want to acknowledge the significant challenges that so many people are facing right now. Employment options are reduced, financial stress is high. There are emergency financial supports available from the city, and I encourage people to reach out to help each other before an emergency occurs. With schools going back to virtual learning for most this week, many families are under the stress of trying to figure out how to work and oversee online schooling. Setting realistic expectations and flexibility from employers are important to make it through this period. No one is perfect or able to do two jobs at once. We are currently under a stay-at-home order except for essential reasons, but not everyone is safe at home. So I want to say leaving a violent relationship to get to safety is an essential reason to leave home. Services are open and available to offer space to those who need it. Nous sommes actuellement sous un décret ordonnant de rester à domicile, sauf pour des raisons essentielles. Mais tout le monde n'est pas en sécurité à la maison. Et quitter une relation violente pour se mettre en sécurité est une raison essentielle de quitter la maison. Les services sont ouverts et disponibles pour offrir de l'espace à ceux qui en ont besoin. Violence is never okay. We all have the right to feel safe and live a violence-free life. And survivors of domestic violence and abuse can get support through a number of community resources, including Ottawa's text and online chat tool, unsafeathomeottawa.ca, which is available 7 days a week from 8:30 in the morning until midnight. You can send a discreet text to 613-704-5535 if you need help. This service is now available in over 70 languages, thanks to the support of Immigrant Women Services Ottawa. So as always, look out for one another, stay safe, be kind. Thank you, merci, miigwech.
Well, Kina, I think I'm next, so I'll go ahead. Good afternoon, everyone. Bon après-midi tout le monde. The province of Ontario has extended its stay-at-home order last week and added additional restrictions. Le gouvernement de l'Ontario a prolongé le décret ordonnant de rester à domicile la semaine dernière et en plus ajouté certaines restrictions importantes. In its announcement last Friday, the province is extending the emergency declaration and extending the stay-at-home order for 2 weeks for a total of 6 weeks, limiting outdoor gatherings to members of your own household, closing many outdoor recreational amenities such as golf courses, sports fields, ball diamonds, basketball and tennis courts, reducing the capacity of retail stores such as grocery stores, pharmacies, and big box stores to 25%, capping places of worship to 10 people indoors, and limiting weddings to 10 people both indoors and outdoors. Permitting only essential construction activities. This includes residential homes, long-term care homes, hospitals, and assessment centers, and controls at interprovincial borders, including Ottawa-Gatineau. Bylaw and regulatory service officers were out over the weekend doing proactive enforcement of businesses. Les agents des services de règlement municipaux étaient sur le terrain la fin de semaine dernière pour assurer l'application des proactifs des règlements dans les commerces. There were a number of calls related to indoor gatherings and private residences. We want to remind everyone that a stay-at-home order is still in effect. Nous tenons à rappeler à tous les résidents que le décret ordonnant le rester à domicile est toujours en vigueur. This means that you should only be leaving your home for essential reasons. Gatherings, both indoor and outdoor, are limited to members of your own household. The one exception to this is that a single people can have exclusive contact with one other household. The purpose of these new restrictions is to keep people at home as much as possible in order to help us stop the spread of COVID-19, and particularly to prevent our hospital system from becoming overwhelmed and save lives. We realize this isn't easy, and in fact is very difficult. Nous savons que la situation n'est pas facile, et elle-même est très difficile pour de nombreuses personnes. We want to see our family members and our friends, but we must continue to follow the stay-at-home order and the new restrictions and our public health guidelines. Bylaw and regulatory services will continue to enforce the COVID-related regulations on both a proactive and complaint basis. Enforcement will continue to focus on non-compliant businesses, social gatherings, and as well as violations to the temporary mask bylaw, which council extended until August 26th. In addition, bylaw officers will be enforcing the Section 22 order issued by our medical officer of health, which requires wearing masks at or within 5 meters of playground equipment in all city parks. A team of bylaw enforcement officers will be deployed to conduct dedicated, proactive enforcement in our parks. Une équipe d'agents de règlement municipaux sera sur le terrain pour assurer l'application proactive des cibles des règlements dans les parcs de la ville. Now, on the vaccine front, we continue to make progress. En ce qui concerne l'administration des vaccins, le travail progresse bien. To date, we've administered a total of 284,597 doses in Ottawa. Last week alone, we administered close to 60,000 doses of the vaccine. We are working hard to get everyone who is eligible vaccinated. Nous travaillons fort pour assurer que toutes les personnes admissibles puissent se faire vacciner. In fact, more than a quarter of our eligible Ottawa residents have received at least one dose. Despite some delays in vaccine supply, we have not canceled any appointments. We've also started administering vaccine to additional sectors of the population, including homebound residents, special education workers, and individuals with high-risk health conditions and their caregivers. And as we receive more vaccine supply, we will continue with our vaccine rollout. Of particular note, in a joint statement issued by Dr. Etches and myself on Monday, we announced that all essential workers of any age who want to receive a COVID-19 vaccine are anticipated to be vaccinated with their first dose, likely by the end of June or sooner if vaccine supply increases. This is another important step as we work to ensure that all Ottawa residents who want to receive the COVID-19 vaccine can access it as quickly and as efficiently as possible. I want to thank you very much. Merci beaucoup.
Thank you very much, Mr. Diamante. My apologies for the technical difficulties. difficulties. Désolé des problèmes techniques. I will now invite questions from each agency alphabetically. You may ask one question and one follow-up. Nous allons maintenant répondre aux questions de chaque organisme par ordre alphabétique. Vous pouvez poser une question et une question de suivi. Again, a reminder to remain on mute until I invite you to ask your question. So we will now go to Joanne Chianello, who is representing CBC Ontario.
Hello, good afternoon. It's nice to see all of you today. You know, I've been covering City Hall a long time, and I don't really recall a time when so many local authorities kind of openly disagreed with the province and what they were doing. And in some cases here, we're not following the directions or have decided to opt out of the directions coming from Queen's Park. And I'm wondering, what about those rules prompted the city to do so? What was the tipping point? And if I could hear from the mayor and our medical officer of health and our police chief, that would be terrific. Thank you.
Thanks very much, Joanne. I'll, oops, I just.
Sorry, Mr. Mayor, we can hear and see you.
Okay, sorry, I pushed a wrong button. There we go. Thanks, Joanne, for the question. I guess, you know, there were a number of issues. There was the random check issue that obviously caused great concern by chiefs of police and mayors and police service boards. There was the playground ban issue. And of course, locally here, there was the Quebec-Ontario border crossing declaration. And I think, you know, at the end of the day, there was just so much opposition to those items that they withdrew the playground edict, and they then scaled back the random check issue. And for all intents purposes, we've gotten rid of the 24/7 traffic jam border check issue between Gatineau and Ottawa. So, you know, to the credit of the government, they heard loud and clear from a number of municipalities around Ontario that it was not on to do random checks, that there was no significant risk for children to play on swing sets. And I don't think they had a great grasp of the complexity and the interconnectivity of the economies and communities of Gatineau and Ottawa. Dr. Etches.
Yes, so we are not ignoring any provincial regulations or suggesting that any provincial regulations shouldn't be followed at this point. Today, I think what you see is that some of the measures have been changed, but the principle behind all of them is to limit the places where people come into close contact with each other, and that is important right now. We definitely appreciate there could have been some downsides to some of the things that had been on the table, and that is important to strike the right balance. We are always concerned with any approach that focuses on enforcement versus supporting people to understand what is needed and to raise awareness of the situation and ways to decrease transmission of COVID. So that's what Ottawa Public Health was committed to doing with our city partners, is make sure people understand, why are we asking people to stick to their household members in parks? Why are we asking people to wear masks when they're in close contact with others? And you know, this is the kind of collaborative, you know, approach and encouraging approach that I think has been effective throughout this pandemic to help people understand what is needed.
Joanne, for my part, I'll echo Dr. Etch's comments. We have not rejected the province's directions. We've customized them in coordination and consultation with our local partners, particularly with the risk assessments that we've had from Ottawa Public Health and Dr. Etch's. In terms of the border operations, we started out with a commitment to assess on a daily basis. We've done that. We've scaled down our operations, right-sized them, and better coordinated them over the course of each 24-hour period, where we feel we've got the right balance between providing a net value of health outcomes, as well as allowing for, as the mayor talked about, a very complex interprovincial and economic environment to continue on at optimal levels, again, all geared towards public health outcomes. We did not feel the need, and still do not feel the need, again, based on the coordinated efforts between ourselves, Ottawa Public Health, bylaw, we still do not feel the need for the use of any of the additional powers. We believe that the health outcomes that Dr. Etches has outlined can be done with the existing powers and with greater levels of coordination, and ultimately greater levels of cooperation from the public around following the health guidelines that have been repeated several times today. And again, I just join in encouraging all people in Ottawa and the surrounding area to do your best to stay healthy, follow the guidelines, and let's help each other through this difficult time.
Yeah, thank you all for that, and I appreciate it. This is my follow-up on the same theme. I don't mean to suggest, of course, that people are going to reject any of the laws or rules, of course, but you know, we have either through the police force said we're not going to take on new powers, or through our medical officer of health's office said we think there should be more stringent issues. When we hear, as residents, as the public, when we hear this a bit of a disconnect at the local level between the province, do you think that sows some doubt in the public's in their trust in the provincial government? You know, I mean, are they? How much does the province understand what's happening in this community? You know, we've said we want to vaccinate essential workers, but we saw the province lower the age for AstraZeneca to 40 instead of, say, opening it up to people who can't stay home to work, right? I mean, what is the message that people are getting here?
Yeah, I think maybe I'll start, and if others want to join in, Joanne, you brought up a very good point. One of the things that I've stressed with ministers at the provincial level over the last couple of days that I've been speaking to is the need for greater pre-consultation when a major decision like we saw on Friday was coming about. Because I think giving us at the elected level and police through the chiefs of police and police boards and medical officers of health, if we were given a heads up on some of these proposals, I think we could have saved a lot of awkwardness and a lot of stress by advocating that, you know, the police check issue was not going to be well received or necessary. The playground situation, the same thing. And we could have better explained the intricacies of 5 crossings plus 2 ferry crossings. So, you know, look, I understand the province and the premier under tremendous pressure. I wouldn't want to be in his shoes because, you know, every day the numbers go up. It's more stress and strain on everyone in the whole province. And there's a lot of, you know, people that can sit back and armchair quarterback. But I think the lesson out of Friday was please give us a heads up, let us know what you're thinking about, and we could at least offer feedback from our perspective here in Eastern Ontario as to what we think will, you know, be well received and will be effective in its implementation. I don't know if Vera or Peter want to say anything else, or Keith.
I think, Joanne, my message to the people in Ottawa is that the local level here is where to turn first to understand what's happening in Ottawa. And the Ottawa Public Health website has the most up-to-date and robust information about COVID in our community and the measures in our community that are needed at this time. And where I think there might need to be changes, if it's an issue that's affecting the province more broadly, like the number of workers that are coming into contact with each other, because a lot of workplaces are still open, that's a province-wide issue, then I do raise those things to the province. If it's an issue specifically to Ottawa, then I'm looking at what can be done in Ottawa, and I'll communicate that to the people of Ottawa.
And maybe Mr. Demonte, if he had wanted to comment on that, on the vaccine front, on vaccinating essential workers versus just everyone who's 40 and over.
Yeah, I mean, I think the mayor talked about it well. You know, they're making decisions with limited vaccine for the province of Ontario, and we're trying to target areas of greatest need. That's informed by the scientific table, by the medical officers of health. I just, so perhaps Joanne, you know, it's a little bit out of our realm. We vaccinate based on the provincial direction, and we have some local maneuvering room here, but not much. I just want to reiterate what Dr. Etch has mentioned, and Chief Slowly as well too, on both fronts. On the enforcement front, there's a coordinated approach. Chief Slowly and bylaw and Dr. Etch's, we try to understand how can we best achieve her public health objectives on the enforcement side, and we adapt to do that. And I would tell you on the vaccine side and our distribution as well, the collaborative approach led by Dr. Etches, but with our hospital CEOs and the entire team that I lead, again, the same objective is there with the vaccine that we have. What are the priority groups we have to get to? And that's what we've done since day one. And a quarter of our population has been vaccinated. And when we look at the data, the right people have gotten vaccinated. We've done our long-term care, those who are most at risk by age category. And now we're starting to filter down into other groups, and we have strategies for that. So I would just encourage the community here to understand that at least locally, and even with input from the province, we very much have our act together, and we're working collaboratively to achieving our public health goals and getting our community healthy and safe as quickly as possible.
Thank you very much, Mr. Diamante. Thank you, Joanne. We will now be going to Matthew Cooper at CBC Ottawa. Matthew, are you there? Okay, I think you're having some audio issues. If you wouldn't mind just sending me your questions, we will go to Eric O'Brien in the meantime.
Hello, can you hear me?
Yes, we can.
Good stuff. Dr. Etches, I'm curious to know your thoughts about the key indicators of COVID-19 in the city, like incident rates and the COVID-19, the wastewater steadily decreasing in the city. I mean, is it good news? Because, I mean, the cases in the city are still really high.
Thank you. I want to give hope to the people of Ottawa that rise that we COVID in our community, maybe not rising so much now, maybe it's stabilized. I cannot say that we're seeing sufficient signs of the curve turning yet. So the way I look at it is the wastewater is showing a decrease in the level of COVID in our community. That's an early indicator that's useful. It's been a less reliable indicator with the spring melt, so it's not perfect. The other early indicator is the percentage of people that are testing positive. There was a terrible thing to see it going up and up and up. Over 10% of people that present for a COVID test would end up being positive. That is no longer rising to the same degree. It seems to be rising. The other measures are a little dependent on the number of people being tested. So our rates are coming slightly down, but the number of people going to be tested is also down. So we have to take care in interpreting that. And then another very robust measure is our hospitalizations. And that, again, all along we said it's not something you can mistake when you have serious COVID. And those really difficult situation, so high in numbers still. However, perhaps a little bit of a stabilization. And so that's certainly what we're watching for. It's a later indicator. It will But yeah, at this point, I want to give people measures are working in Ottawa, that this is difficult to maintain a stay-at-home order. But if it's going to get us out of this situation, then please take encouragement from this and continue doing what.
As a follow-up to that, now, I'm just curious because, like you said before, variants are at almost about 100%. I'm not sure if it's all of the cases or in the wastewater. Maybe you can clarify that. But how is the variant spreading in Ottawa? Are you seeing changes to the way it's spreading? How is the city keeping track of that? Because like I've talked to other health regions, and what they tell me is that they're basically seeing a loop of it spreading in the workplace and at home, even before sometimes people don't even know that they have COVID.
Right. So when I refer to the indicator that perhaps the variant is almost 100% of that virus that's in Ottawa, that is a wastewater signal. So the testing that we do, not every sample can be screened for a variant. Not every sample is processed, and we don't always detect it that way. So where is COVID being transmitted? The most common place is still in the home, among household members. Indoor environment, no masks, it just continues. And so how does it get into the home? It is when people are outside of the home in close contact with others. So it would be in workplaces. And I listed some of them today where we've seen more transmission, construction, restaurants that are offering takeout are standing out a bit. Those are environments where people may not be wearing masks as much in close contact if they're taking a break or working hard in environments where it's hard to maintain mask use. The outbreaks that we're detecting, I would say a change in what we're seeing is that they're across many different types of workplaces, and the number of workplace outbreaks is higher than previously, when we saw more outbreaks in healthcare settings and in schools and in childcare. Of course, with schools closed, we start to see a decline in the outbreaks detected there. Does that answer your question?
I kind of. So what you're saying is that it's more generalized. It's not one outbreak that's causing multiple cases. You're seeing more across the board cases arising. That's
correct. So when we have COVID across our community, which we do, there is no one hotspot, right, that we could just target and take care of COVID. No, it's across our whole community and it's across all age groups. Then we see it entering into all types of workplaces where people are still working, not able to work from home. So that is more of an Ottawa pattern in terms of multiple smaller outbreaks compared to, say, one particular sector.
Thank you.
Thank you very much. We will go back to Matthew Cooper to see if the audio was fixed.
Hello? Hello,
Hi.
Can you hear me?
We can hear you.
I'm in, amazing. Thank you. So first, I'd just like to ask, I guess this is directed at Dr. Etches and Councillor Eglai about the request for the review about restrictions related to business. What are you hoping would be coming from that review? What action would you be expecting from the province? And I know you were saying that it's there's less workplace spread here than in Toronto and Peel, where there has been some action from those medical officers of health. But if you don't get the action that you're expecting from the province, what would you be doing then?
Well, we sent the letter, and there have been communications back and forth between OPH and the government on this. We're hopeful they'll see the sense of what we're proposing. There were stricter definitions previously as to what essential was. we'd like to go back there and possibly tighten it up even further. As we've all said today, our hospitals are at a critical situation. We need to do everything we can to keep the hospitals up and running as they should and to protect our community. So we're hopeful that the province will understand where we're coming from and see our request in that light. And as I said, we just sent it off and there have been discussions. So it's early days, but we don't want to let it sit too long. And I'll let Dr. Etches speak to what happens if we can't come to some sort of an agreement with the province on this.
Right, so there were a few different aspects to the motion. The first was about trying to limit the number of businesses that are open that where people could be exposed to COVID. We're going to continue to use our local data to take a look at what's needed here in Ottawa. So we would, if the province is not limiting businesses, we need to think about what is required here. That motion was aimed at the provincial level because it's an issue across the province. The other piece is around the ability to enter into businesses, to perform inspections, and even to close businesses in the very rare, it is rare circumstance where there is ongoing non-compliance with regulations and ongoing risk to the public for COVID transmission. That is something that, again, we will act on that. If the province does not do something, we'd be looking at local powers to be able to enter into a business and close a business. And then, I think the other comment you made was related to Toronto and Peel doing some sections, some orders related to workplaces. That is quite a different type of order that they did there. That was once there's been an outbreak. So rather than trying to prevent them, it's looking at if there's something larger, 5 or more people in a workplace testing positive, then having the ability to close those businesses for a period. That's like outbreak management approach. And we feel here in Ottawa, we have the capacity to do that kind of outbreak management. So our teams are actually looking at workplaces where there's 2 or more people testing positive, and we do the follow-up to control onward transmission. So again, that's something that I don't think is needed here at this point, and we'll continue to review our data.
Right, and I guess this goes to some of the hospital capacity issues that we're seeing, and some of what the situation is looking like in ICUs and the COVID patients that are coming in. There was a tweet this week from the president of the Queensway Carleton Hospital, where he said almost half of their COVID patients are, in his words, people of color. And I was wondering if Ottawa Public Health has a bit more of what that picture looks like in hospitals across the city, and just, I suppose, what your reaction is to that observation from the president of the Queensway Carleton Hospital, and what this situation is looking like, this third wave is looking like on racialized populations in our city.
Unfortunately, the observation from the Queensway Carleton Hospital, it reflects what we've seen throughout the course of the pandemic. It's what we're working hard to try to change, but it reflects structural inequities that people face when they are newcomers to Canada, to Ottawa, newcomers who have less employment options, who are living with lower incomes, often from racialized communities. Our data that we collected early on, we were early in recognizing the need to understand who was testing positive. It did demonstrate Black communities in particular and newcomers in particular are definitely at higher risk from COVID. It's why we've had community level operations in partnership with the Ottawa Local Immigration Partnership and community health centers, the Ottawa Health Team, Équipe Santé Ottawa. Many partners focused on this, trying to provide more supports to communities where it's harder for people to isolate. We opened a voluntary isolation center, which is still operating actually. So if people people are testing positive and they don't want to expose their family and their household, there are free room and board spots still available. That is a service that exists. We continue to also prioritize these communities for vaccination. And that, again, is ultimately where we're going to be able to best protect people. And we know that the interest is there as the supply grows, that will continue to grow as an initiative. And so it shows that things aren't fair in our city, and we need to work hard to change the systems and the structures that provide more advantage to some populations. And through our pandemic response, it requires partnership with those communities, and that's the way we're committed to continue to work.
Thank you very much. We will now be going to Josh Bringle at CTV Ottawa.
Thank you very much. I'm just going to follow up on Matthew's question about the tighter restrictions on businesses. Would Ottawa Public Health and the city like us to go back to what it was a year ago at the start of the pandemic, where only restaurants are open for takeout and most non-essential businesses can't even do curbside delivery or pickup? Is that what you're looking at in terms of restrictions on non-essential businesses?
I'll speak if you like. So yes, we are looking at, we need to limit the number of places that are open that provide a place for COVID to be transmitted. And we need to focus on the businesses staying open that provide food, medicines, health and safety services and products, really truly essential services that we need. And so it would be a more limited number.
And if I can just add quickly, our situation now, as we've been saying for some time, is worse than it was then. So yes, we would like to go back to at least those conditions to respond to this more significant risk in our community.
Do you have the power to implement a Section 22 order to shut down all non-essential businesses, or would you like the province to do it province-wide so it's a level playing field?
Sort of not exactly either or. What I am putting forward is important for more places in the province. So I would say it's most important for the places where COVID is rising rapidly. There are parts of the province where COVID is on the decline again. There are parts of the province where the rates of COVID are not as high. And so it's really, to take a look at the places where the curve is not flattening, the curve is not turning, what else can be done? And that is a provincial question. It's out of my jurisdiction. It's broader than that. But I will continue to think about what can be done here locally, what's needed here locally.
Thank you very much. So now we will go to Craig Lord at Global News.
Thanks very much. Dr. Etches, this morning at the Transit Commission meeting, there was a motion passed that would ask the chair to write to you and also to the Ontario Chief Medical Officer of Health to request that transit workers are put into consideration for priority in the vaccine sequencing. Is that something that you would do, have the power to do, or would otherwise look to influence the province to raise these frontline workers in the vaccine queue?
Yeah, if I can start in answering this question by providing a little more context. I know Mr. DeMonte spoke about sort of where we're at in the vaccination program, and I want to underline that first and foremost, we needed to protect older adults. Right, so our vaccine program, the mass clinics, trying to get as many people through as we can, focused, it's open mostly to people over 60, because they are so much more likely to die if COVID reaches them and there's an infection, and they're much more likely to be hospitalized, and we have to keep people out of hospital. So that focus on people over 60 has been very, very important. And that's in the provincial framework, and I agree with it based on the science. Moving on is happening very soon, right? So by the end of April, in 9 days, will have protected most people over 60. And we're able, under the provincial framework, to turn to some of the other phase 2 populations. And what we see is we need to prioritize people who cannot work from home. And that is in the provincial framework as well, where there is a provincial direction is to do them in groups. First group of people who cannot work from home, and then second group of people who cannot work from home. The first group includes people who work in food distribution and childcare and education and farms. And the second group right now, that is where people who work in transportation are sitting. So I do not see under the provincial framework that I can sort of switch people up between groups 1 and 2, but we're always having conversations with the province about what we see locally. Where I have discretion and I'm working not just Vera Etches on her own, but with input from the community affected through a sequencing task force, is to look at this group 1, first of all, of people who cannot work from home, and bring some sequencing to that group. Because there are many, many, many people in those categories, and they're all important. We need to consider who's at more risk of exposure. There's different factors that go into trying to narrow it down because we only have so many vaccines a week. We want to do everybody in these groups. And I would encourage, of course, right now, people who cannot work from home to get their vaccine wherever they can if they're eligible by their age or their neighborhood or their type of work, that kind of thing. So I think I'm happy to receive information about people's opinions about what's needed in Ottawa, and I will pass that on to the sequencing task force, and they will be public about their assessment, and we will be public about how we're moving through the groups of people who cannot work from home.
Thank you. And my second question would also be to you, I think, Dr. Etches, and it's about hospitals. So I'm wondering if you're hearing from many of the hospital partners in Ottawa how we're doing in terms of ICU capacity, and if we are still accepting transfers from other regions of the province, or what that looks like right now in our healthcare system.
I last spoke to my hospital colleagues, I believe it was either yesterday or the day before, and I apologize, there's noise outside. We did at that time get a sense from them that there was some stabilization happening, and that they had taken about 20 people from the GTA into Ottawa area hospitals.
Thank you.
Thank you, Craig. Nous allons maintenant passer à Julien Paquette, le droit.
Bonjour. Je voulais vous demander, Dr. Etches, concernant la demande que vous faites à la province aujourd'hui. Essentiellement, on comprend que c'est de limiter le nombre de milieux de travail qui sont ouverts. On s'entend que s'il y a des milieux de travail, des secteurs à bureaux, par exemple, on aimerait que ce soit fermé. C'est assez évident. C'est le genre d'environnement où c'est plus facile de faire du travail à distance. Où est-ce que ça laisse des milieux de travail comme, par exemple, un entrepôt comme celui d'Amazon qui fait la livraison de services, de produits qui peuvent être considérés essentiels? Où est-ce que ça se place, ces entreprises-là qui sont un peu dans une zone grise, là, à savoir, est-ce qu'on donne des produits essentiels ou est-ce que c'est plutôt non essentiel? Je ne sais pas si vous comprenez ma question.
Oui, je pense, oui, et aussi j'ai besoin de réchauffer mon français, je pense, après une semaine de congé. Mais la question, c'est concernant le nombre des entreprises ouvertes maintenant et où est-ce qu'il y a l'espace pour réduire le nombre des entreprises ouvertes, parce que ça, c'est la demande, c'est de réduire les opportunités pour la transmission de COVID-19 dans le milieu de travail. Alors, mon recommandation, c'est de concentrer sur les entreprises où ils aident avec le transport et distribution de nourriture, de médicaments, où les services sont importants pour la sécurité et la santé de la population et de réduire les autres.
D'accord. Puis j'aimerais, en question suivie, en fait, je ne sais pas exactement comment poser cette question-là, mais considérant qu'il y a environ un mois, on passait en zone rouge, puis on demandait même à la province d'essentiellement de relâcher certaines des mesures associées à la zone rouge, notamment le nombre de places de personnes qui peuvent être assises dans un même restaurant en fonction de la grandeur des lieux. Un mois plus tard, on est à un point où on demande carrément la fermeture du plus grand nombre d'entreprises possible. Est-ce qu'on a peut-être un peu sous-estimé la venue de la troisième vague, sous-estimé l'impact des variants, par exemple?
Le niveau de COVID dans notre communauté pour la zone rouge, c'était 40 par 100 000 personnes. Et maintenant, maintenant, c'est plus que 200 pour 100 000 personnes. Et c'était un grand changement. Et c'était un changement qui a arrivé vite. Et c'était toujours difficile parce qu'on veut utiliser on veut utiliser les actions les moins restrictives et quelquefois c'est pas assez. Et c'est certain avec les variants préoccupants que c'est plus difficile. Ça demande des mesures plus strictes. On a discuté ça avec la population et les gouvernements, c'est certain. Mais ça prend temps pour tout le monde de voir. C'est vrai qu'on peut avoir une augmentation exponentielle. C'est difficile pour le cerveau des humains de comprendre la possibilité de cette augmentation exponentielle. Mais on peut voir la réalité et c'est pourquoi il faut plus de restrictions maintenant.
Merci beaucoup.
Merci, Julien. We will now go to Jackie Miller at the Ottawa Citizen.
Hi there. I was wondering, Dr. Etches, if you've received any tiny little indication from the province on when in-person classes might resume for the elementary and secondary school kids, and if you have an opinion on what benchmark should be used for the schools to reopen.
I have not had any conversations with anybody about when schools might be able to reopen. My sense is we need to clearly see that the curve has turned and that we're bringing the level of COVID back down in our community. And then they should be one of the first things to reopen. I also think that it's worth thinking about if it could be done in stages to be able to accomplish schools opening sooner rather than later. Could we get elementary students back to school first, for example, and then move on to secondary students later? But these discussions are premature today because we still haven't turned that curve, unfortunately. And I know this is a really challenging start, right, to the in-home learning this week. And it's not encouraging, but if we're doing what we do now and it holds and we continue to see some potential progress, in turning that curve, that will lead to those discussions about schools reopening as a first kind of measure.
Thank you. And I wanted to ask you about rapid testing in workplaces. I'm wondering what you think the role would be to help prevent outbreaks it's pretty expensive and complicated for private businesses to do it themselves. Are there any plans for pilot projects like the one in Kitchener where they have city buses parking in front of workplaces with the nurse inside and the workers can just hop in the bus and get tested?
We have been promoting the existing program that's a provincial program where businesses can sign up and get support to be able to do rapid testing in their workplaces. Much of the onus is on the workplace to organize the programs, but there is a provincial program that we've been really promoting locally, and now we do have other businesses are stepping forward locally, indicating they're willing to do this and want to move ahead, and I think this is good. I think the more testing we have, the more COVID we'll find. It will tell us about where COVID is or isn't. It's not a perfect system. We know there are downsides to rapid testing, but it's an additional measure that can give us more information. And so we are right now in conversations with workplaces locally to see how we can help them to do more of this.
Thank you very much. Thank you, Jackie. We will now be going to Blair Crawford at the Ottawa Sun.
Hello, my question concerns construction sites. I think Dr. Etches said that a couple of the outbreaks had involved construction sites. I live in Bay Ward, which seems to be entirely under construction between road work and the LRT and condo construction. But I have seen that there are some sites at some of the malls where there are workers on site right now. And I'm wondering why those are exempt, or if they're exempt, and who's responsible for monitoring and shutting them down.
Perhaps I can assist, and then Dr. Etches if she wants to add. So there are exemptions to the construction, as I indicated, residential homes, projects for hospitals, long-term care facilities, and you mentioned our LRT are exempt. They have to follow the rules. It would be the Ministry of Labor, and as a matter of fact, last weekend the Ministry of Labor was here in town visiting those sites to ensure that those employers are following the rules and the guidelines set out by the province. Bylaw would have a limited role in that. If we got a complaint, we would be normally forwarding that to our colleagues at the Ministry of Labor. I don't know if Dr. Etches wants to talk about how, she may not know how the province decided yet. So it's the province that made those decisions as who was exempt with regards to.
Yeah, I might just add, Blair. Sorry, Blair, I just might add, just out of coincidence, last week I had a briefing on the East-West LRT, and the senior management team proudly talked about that they have not had one single COVID-19 case on their work site, and that's a long work site, as you know, all the way to the East End and the West End. So that's encouraging, and we encourage all employers to be as responsible and to ensure that their workers are doing socially distancing as best as possible. Sometimes that's almost impossible when you're on a construction site, but also wearing your masks. And I live near Byron Avenue, and I go by it almost every day. And I think with one or two exceptions, I've seen every employee on that site masked up.
Yeah, this specific site I was talking about was at Carlingwood Mall, the construction that's underway there, and I saw workers there. And I thought the Premier had specifically said that mall construction was non-essential.
Yeah, you'd have to really have to go to the province. It's the province that determines what is essential construction and what is not. We know one of the first things we asked was, were our transit and road projects and path projects essential? And the answer came back from the province that they were. As for the others, you'd have to ask the Ministry of Labor. Thanks.
Okay, my follow-up question is, and I believe this is correct, but the current RT, the 7-day average for RT in Ottawa is 0.95. I think that's right. And I'm just wondering, when was the last time that it was below 1? And again, similar to a question that was asked earlier, what Dr. Etches makes of whether we've turned the curve and what might be contributing to the good news.
Thank you. I will reiterate that I can't say we've turned the curve, but I can give you hope that the measures are working, that the rise has slowed and we might be going horizontal. Things might be stabilizing. The curve that shows the reproductive number of the number of people, if one person tests positive, how many other people go on to be positive. If it's below 1, then it means the COVID level is decreasing. If it's above 1, it's growing. I'm looking very carefully at our dashboard to see when it was last below 1, and I believe that was February 28th or around there, February 27th. It looks like it was just below 1. So it's been a little while. It's encouraging to see that. It's not a perfect measure because it is still tied to testing. As is the rate in our community. If the number of people being tested has dropped, we might not be detecting as much COVID, and that means, again, the reproductive number might not reflect everything exactly in our community. So we're looking for a decline in hospitalizations to really underline and confirm that we're on the right track. But I do think, that it is worth understanding these are difficult measures that are in place. We will get out of them if we hold to them, and the sooner the better.
And can I just clarify, when you talk about the hospitalizations going down, do you recognize that there are patients coming in from out of town, the 20 from GTA and sort of?
That's correct. Our website actually, when we measure hospitalizations, it's reported only for people who are residents of Ottawa. So that trend won't be disturbed by any other patients we take in from Gatineau or the GTA.
Thank you.
Thank you very much. Nous allons maintenant passer à Mama Afou à Radio-Canada.
Oui, vous m'entendez, ça va?
Oui, on vous entend.
Excellent. Donc, ma première question va aller à Dr. Vera H. Concernant en fait la lettre que vous avez envoyée au Premier ministre là, par rapport au plus de restrictions, notamment la surveillance des lieux de travail. Pourquoi avez-vous décidé d'envoyer cette lettre alors que vous dites vous-même que la situation commence à se stabiliser ici à Ottawa?
J'ai envoyé cette lettre parce que la situation en Ontario est sérieuse. C'est clair. Dans les lieux aussi à Toronto, à Peel, le taux de COVID-19 ne diminue pas. Et c'est important de réduire les opportunités pour la transmission de COVID-19. Et c'est clair ici aussi à Ottawa, s'il y a moins d'opportunités pour la transmission, ça va aider aussi de tourner la courbe. Mais c'était une lettre pour le Premier ministre parce que c'est un défi pour la province.
Est-ce que vous pouvez juste me donner les détails de ce que vous avez demandé dans cette lettre en français? Je sais que vous l'avez dit en anglais, mais ça en aurait besoin en français. Qu'est-ce que vous avez dit principalement dans cette lettre?
Oui, aussi je peux fournir, je pense, une traduction de la direction de la santé, le conseil de la santé. Je peux juste faire cette note pour l'équipe d'envoyer les mesures en français. Mais le grand sommaire, c'est que au cause de le niveau de COVID-19 et la réalité qu'il y a beaucoup de transmission dans les milieux de travail maintenant, il faut réduire les opportunités pour cette transmission par limiter le nombre des entreprises ouvertes et concentrer sur les entreprises qui sont associées avec la distribution de la nourriture et les médicaments et qui aident avec la santé et la sécurité de la population. Et c'est quelque chose que la province a fait déjà et c'est possible de réduire la liste des entreprises essentielles.
Merci beaucoup. Ma question suivie irait au maire Jim Watson et au chef de police, Monsieur Slowly. Par rapport j'aimerais avoir une réaction de votre part par rapport au verdict de Derek Chauvin. Et je vous demande, Monsieur Slowly, si cela va pousser la police à changer ses pratiques.
Oh, Mr. Mayor, you're just muted.
Excusez-moi, oui, certainement, je suis d'accord et content avec la décision du système juridique de l'États-Unis. Ça, c'est la décision correcte. Tout le monde a vu la vidéo et c'est vraiment une tragédie pour M. Floyd et son famille. Et comme je dis, maintenant, je pense que M. Biden et ton cabinet fait des choses pour améliorer la situation avec certaines communautaires dans les États-Unis. Et peut-être, Chief Slowly, if you could just offer your comments on the decision by the U.S. courts in Mr. Floyd's situation where the constable was found guilty and any changes that you envision in the Ottawa Police.
Merci beaucoup pour votre question. En anglais, s'il vous plaît. Former police officer Derek Chauvin was convicted on all 3 counts of criminal charges against him in the murder of George Floyd. The Ottawa Police Service and all of its members stand with all the communities who've been impacted by this tragic set of circumstances. The death of George Floyd, the resulting demonstrations, the criminal prosecution, and other events still unfolding in real time in Minneapolis, across the United States, here in Canada, and here in the nation's capital. The circumstances of George Floyd's murder shone a spotlight on the historical and current reality of systemic racism in policing and in our justice system. As a police service, and as our police service members, we're sworn to serve and protect the community. All members of the community, without fear, without favor, and without bias. We're supposed to be part of the solution and not part of the core problem. Our oath of office requires us to demonstrate the highest levels of duty of care and the highest levels of public trust. There is an increasingly urgent need for police services to form true community partnerships, like what we've been talking about here with Ottawa Public Health and other not-for-profit sector partners. Through these partnerships, we can better prevent crime, reduce the number of people who enter the justice system, co-produce improved community safety and well-being, advance a more just and inclusive society, especially for those who are most vulnerable, most victimized, and often the most racialized members of society. Indeed, we can see from this pandemic that those who often have the least often suffer the most. Every person, every organization, every institution can and should do more to help prevent such human tragedies. I'm committed, and so is my service committed, to doing more. Members of the police and justice system must do our part to address head-on all systemic elements within our institution that contribute to the conditions which underpin such devastating events. We need to do more, we need to do it better, and we need to do it more effectively. We'll be relentless in our focus to do just this. I appreciate the question. I'll turn things back over to the moderator.
Thank you very much, Chief Slowly. We will now be going to Kenyon Wallace at the Toronto Star.
Hi there. Thanks so much for taking my question. This is my first time participating in an Ottawa press conference, so I ask for your patience and your forgiveness if I'm revisiting a topic that has already been talked about earlier this month. But my question concerns this issue with the K2V postal code as a hotspot. And the reason I'm revisiting this is because my colleague May Warren and I recently reported on the Ontario Science Table's initial recommendations for hotspots and how they were differing from those that the province ultimately came out with. And my question is for Dr. Etches. On April 13th, Christine Elliott said that she was speaking to reporters, and she said that the K2V postal code, or I guess I should say forward sortation area, was designated a vaccination hotspot based on your recommendation. So is that true? Did you recommend that K2V be included in the province's hotspot list for vaccination?
I think the minister is correct that we work together on how the vaccine program with provincial direction is going to be implemented locally. And, I'm part of a group that has a conversation with ministry leaders every week on behalf of the Council of Medical Officers of Health, where we provide strategic advice. Does it make sense to focus on neighborhoods that have the higher rates of COVID? And yes, that's what we said. We should focus on areas that have higher rates of COVID. So the principles in general, that is something where we did agree. In terms of a specific list, when it came out, we've got the list and we'll use the list and adapt to what's needed in our area. And so that's really how it's working right now, is we're focusing within those forward sortation areas where the rates are higher with a neighborhood-based approach in Ottawa, because we do see a connection in terms of the most effective use of vaccine should focus where we can protect people at greatest risk.
So if I'm hearing you right, you did not recommend the K2V postal code. Is that correct?
I think specifically, probably not specifically, but in terms of the approach in general, it is something that we support.
Okay. Do you know how they came up with, like how they arrived at including the K2V as a hotspot?
I don't. I can't speak to that specifically. I think the concept is valuable. We're using that concept locally to really focus on neighborhoods. We know lower income neighborhoods that have higher rates of COVID are also where people who can't work from home are often living. And so again, that's a phase where we're really starting to be able to grow at this point.
Okay, thank you very much.
Thank you very much.
Can I ask a follow-up? Is that possible?
Sure.
Sorry, if you were coming up with, like, let me put it this way, if you were coming up with hotspots for Ottawa Public Health, would you have included the K2V postal code?
In Ottawa, we find that actually they're called forward sortation areas, right?
Yeah, sorry, that's what I mean.
Yeah, the first part of the postal code is actually too big.
That's right. You're right. The K2V forward sortation area is what I mean. Would you have included that as a hotspot for vaccination if you were doing the list?
It's a bit too big for us to focus on that whole area. So we would, we have specific postal codes where we would prefer to focus.
And that's because
which the ministry is supporting. So, in terms of, we're on the same page with the ministry in terms of we need to use local information, and they support us to do that. In
terms of that particular forward sortation area, though, would you have, like in terms of its, like hotspots are supposed to be areas in which the infection risk is high or infections are already higher. So would K2V already be on your list, or would it not have been on your list if you were doing it yourself?
So as a large geographic area, there may be smaller, areas that would be more of a priority. So, yeah.
Okay, thank you.
Sorry about that. Can everyone hear me?
No.
Okay, thank you very much. We will now be going to Catherine Fortin at TVA Gatineau.
Oui, est-ce que vous m'entendez? Est-ce que vous m'entendez?
Oui.
On vous entend.
Oui.
En fait, la question a déjà été posée là, au tout début, mais c'est juste pour avoir une réaction en français là, concernant les barrages. Pourquoi on a décidé là, de changer de méthode? Puis est-ce que ça va être aussi efficace que la surveillance 24 heures sur 24, 7 jours sur 7?
Mais peut-être je vais répondre et peut-être Chief Slowly va ajouter une réponse. Certainement, c'est évident lundi que le système ne marche pas. Il y a des grands problèmes avec la circulation sur les ponts, plus de 10 kilomètres. Et je suis content que Chief Slowly et son équipe a décidé que ce n'est pas nécessaire d'avoir des barrages 24 heures par 7 jours. Ça coûte beaucoup de l'argent, plus de 113 000 et ça prend presque 100 agents de police. Alors, certainement, j'ai écrit une lettre à Mme Jones, le ministre qui est responsable pour cette activité, et je dis que, à mon avis, ce n'est pas nécessaire, ce n'est pas efficace, ça coûte beaucoup de l'argent. Et je suis content que le chef de police d'Ottawa a déterminé que ce n'est pas nécessaire d'avoir des barrages à les 5 ponts et les 2 autres places pour, c'est pas le mot en français, ferries. Chief Slowly, can you maybe just offer a comment in terms of why you've downsized from the 24/7 to more random spot checks? Merci.
Chief Slowly, you are on mute.
Thank you very much for the question. As I explained earlier on, but I'll repeat again, when the interprovincial border security requests came in, our responsibility was to assess our ability to implement the order. That starts with, first and foremost, understanding the intended health outcomes for our local context here in Ottawa and the unique circumstances that we have across the border with Gatineau and in the immediate region around. We commenced discussions with Dr. Etches, Ottawa Public Health, General Manager DeMonte and Bylaw, as well as our other city partners to better understand how the new measures and the interprovincial border restrictions could contribute best to health outcomes. We did our best literally in real time to plan throughout Friday, Saturday, Sunday, several phone calls, joint planning meetings, joint risk assessment meetings with our core partners to establish by midnight, Sunday night, go to public health. Our commitment to reevaluate at the end of each day has been maintained. As we completed the operations of the first day, it was clear to us from feedback that the overall effect of the operations was not improving public safety outcomes. So we immediately started to scale back on day 2. And at the end of day 2's operations, the review again determined another level of reduction in resources. We currently now have a substantially lower level of resources and a much more flexible deployment model, which allows for a better flow through of traffic throughout the day, particularly during the key morning rush hour period, where the vast majority of residents from Gatineau and Quebec, particularly those who work as essential services and healthcare workers, are able to arrive at their work and make their contributions to positive health outcomes. We've reduced the risk to the community in regards to traffic safety, and we've reduced the health safety issues for our members and the community members, while still maintaining a very effective posture around the interprovincial borders to be able to achieve a measure of health outcomes around that extension. We'll continue to evaluate every single day, and we'll continue to evaluate the costs, evaluate the operational impacts on our other responsibilities as a police jurisdiction for Ottawa, but most importantly, to evaluate whether or not the overall operations are contributing to public health outcomes. We'll continue to work in support of Dr. Etches and the Ottawa Public Health team to make sure those evaluations are consistent, coordinated, and well communicated. Thank you.
Merci beaucoup. Catherine, vous aviez capté ça?
Oui, mais en fait, j'ai une question de suivi pour Mme Variance en lien avec les barrages. Est-ce qu'on croit que ce sera vraiment une mesure qui va avoir des impacts pour aider à faire baisser les cas de COVID-19 à Ottawa?
Notre perspective santé publique, c'est que nous sommes une région où le niveau de COVID-19 et les tendances sur les deux côtés de la rivière sont vraiment similaires. C'est important de réduire la mobilité et c'était notre avis, moi et le médecin-chef en santé publique à l'autre côté de la rivière, Dr. Brigitte Pinard. Nous sommes en contact régulièrement et on dit la même chose, restez chez eux, évitez les voyages non essentiels. Mais concernant le danger de transmission autour de la ville et entre les deux villes, c'était quelque chose qu'on vit avec parce que nous sommes une région. On a aussi la même chose avec l'ouest et l'est et le sud d'Ottawa. Nous sommes une région où c'est difficile de limiter la mobilité pour les travailleurs en santé. C'est aussi important de considérer l'impact sur nos hôpitaux quand leurs employés est tard pour le travail. Et c'est pourquoi j'ai donné mon soutien à le changement de réduire les obstacles pour les travailleurs en santé.
Merci.
Merci beaucoup, Catherine. We will now go to Sue Sharing from On the City from the Burbs. I don't believe Sue is still on the line. Sue, please speak up if you are. Okay. So thank you very much, everyone, for your time. This was a very long avail. Merci à tous pour votre temps. Have a great day. Bonne journée.
See, thank you.